Hi, I'm Colleen Hutchinson. I'm here with Matt Hutter at the Minimally Invasive Surgery Symposium at the Encore Wynn, Las Vegas. Thanks for being here.
Thank you for having me.
Let's talk today about patient-reported outcomes. Can you give us a little bit of an overview about patient-reported outcomes and why collect them?
Sure. Well, patient-reported outcomes are outcomes reported by the patients. That's simply what they are. And it describes really what they are experiencing, what they find with regards to their quality of life, their functional status, their symptoms. So these are really important. This is what patients care about most. And so we're very excited to be including this in the MBSAQIP data collection program.
Okay, great. How will the sites collect the information?
When a patient registers for surgery and is scheduled for surgery, they'll have to capture their email address, and then everything else is automated by the information technology company that's running this. So basically, once we have that email address, then we'll send them validated survey questionnaires that the patients will fill out before surgery, 1 year after surgery, and annually thereafter to figure out how well they're doing.
I would think that would help with follow-up, too.
Oh, that's one of the other potential benefits from this is to decrease the data burden with regards to long-term follow-up, perhaps get better long-term follow-up.
Yeah.
And more importantly, right now we capture, I call it death and destruction. We capture morbidity and mortality very well, but if we capture what they care about most, their quality of life, it'll be really powerful. So we're very excited about this.
What do you hope to learn from this collection of data?
Well, we want to know how well they're doing before surgery and how well they're doing after surgery, how effective the operation is. Right now, we know if they lose weight and we know if their diabetes goes away, which is very important. But their quality of life, how obesity impacts their life, and how different operations do, and over what time frame. So I think we have a lot to learn, and at the end of the day, what we'd like to do is to allow each patient to figure out what the right operation is for that patient. Is it a sleeve? Is it a bypass? And what is the right operation? If they know how happy they'll be, or their functional status, or their quality of life, it'll be pretty powerful.
Who analyzes the data?
Well, the MBSAQIP data has a data statistical team that will be able to do this. This is part of a bigger grant. A patient-centered Outcomes Research Institute, or PCORI, has funded this program in order to get it up and running. And so as part of that, the data analysts at the Mass General Codman Center, which is a surgical outcomes group that I run at the Mass General, and in conjunction with the American College of Surgeons statistical team, then we'll analyze this. But we'll be able to link not just their patient-reported outcomes, but then to all the other rich data that we have, complications, effectiveness. So it's pretty exciting.
From the patient perspective, what's the time commitment involved in what they're doing?
The surveys are pretty short, and so 3 to 4 minutes for them to fill out these surveys. So it's really not too onerous from their standpoint. It's all electronic, so they'll get a link and they fill that out. From the patient standpoint, we've already started a pilot of this, and they're pretty excited about it. They see their results in real time.
Oh, that's great.
Compared to others as well. And the surgeons, they have a dashboard. So I'll be able to see how my patient's doing compared to everybody else in my center, but everybody else across the country with regards to patient-reported outcomes.
Well, thank you very much for being here.
Thanks, Colleen.